We're going to do things slightly differently today. I'm going to go through the charts. I'm joined by Professor John Newton from the Test and Trace programme, and we'll then answer questions from the public and from journalists. And if there's one message that we have today, it's that it is incredibly important for anybody who has symptoms of coronavirus, a cough or a fever, or a change in your sense of taste or smell, that you get a test. Because it's by people coming forward to get the test, which you can get on nhs.uk/coronavirus, or by dialing 119, it's by getting those tests that we're able to identify those who've got the virus, ensuring that you get the best possible treatment, and ensuring that we can then trace the virus and that we can, through that, we can control the virus. So that is the most important message and what everybody can do to help to control this virus. If we turn now to the slides. The first slide shows testing capacity and new cases. And yesterday, there were 128,437 tests in the UK, meaning that there's been a total of 4.48 million tests that have been carried out since the start of this crisis. Now, of course, testing capacity stands at a higher level. Testing capacity stands at 206,444. And this shows that there is extra capacity for more tests, and tests are available right now on the website if you go to nhs.uk/coronavirus, or if you can't access the web, if you dial 119. And I wanted to highlight that because it's so important that people come forward for a test, and anyone who needs a test can get a test. The next, if we stay at the previous slide, the next chart shows that there are 1,570 cases confirmed as of yesterday. And this is the lowest number since the 25th of March. In total, 276,000 cases have been confirmed in total. But this number of 1,570 it shows that we've seen continued downward progress in the number of new confirmed cases. Next slide, please. Thank you very much. We're getting this virus under control, and this is why we can make the cautious, small, positive steps that we've been able to make today. And if we look at the number of admissions with COVID-19 to hospital at 479, that's down from a peak of 3,121 on the 2nd of April. And the proportion of people on mechanical ventilators, the number that corresponds to that 9% figure is that there are 606 people on mechanical ventilators. Again, that is the lowest since late March. Next slide, please. The picture is repeated across the country, where we've seen in almost every case the number of people in hospital with COVID-19 is the lowest since late March. And as of yesterday, there were 7,541 people in hospital with COVID-19. If we go to our final slide, sadly, 39,045 people have died with coronavirus, confirmed with a positive test. That's 111 yesterday. Again, that figure is the lowest figure since lockdown began on the 23rd of March. So we can see from these charts the pattern right across the board, which is that on the substance, we're making significant progress, but there is still more to be done. And I just want to say a few notes of thanks. Thanks to our volunteers responders, who in their hundreds of thousands have come forward and stepped up to the plate. Thanks to the charities and the charity groups who are working so hard in very difficult times. Thanks to colleagues in the NHS and in social care. Also to the businesses, the pharmaceutical companies and the diagnostics companies, without whom we simply couldn't have mounted this response. To the pharmacists and the dentists, and I'm very pleased that dentistry is going to restart from next week. And especially for their hard work and their understanding, all of the families who stand behind those who are on the front line. And at the start of Pride season, I want to take a moment when we can't get together as we normally would to thank all colleagues in the LGBT community who do so much in the NHS and across social care. I think these data show that the action plan is working. The data show that we're winning the battle against coronavirus. Today, we're therefore able to make some cautious changes to the lockdown rules carefully and safely. Of course, these are balanced judgments, and we take these decisions very carefully. We must all remember that in the war against this virus, we are all on the same side. We've come so far together, we can take these steps together. But do not step too far. The disease is not done yet. We mustn't throw away the progress that has been made. So please take your responsibilities seriously. If you have symptoms, you must get a test. And if the NHS asks you to isolate, you must do so. And to everybody, please, stay alert, control the virus, and save lives.